Hi everyone, this is Aurelie Najm. I am reporting for Now live from Vienna Conference Center. It's day 3 and there's been so much great science so far. I want to draw your attention on one poster that I saw this morning that reminded me that maybe I need to do a bit more for my patients in my current practice when it comes to mental health. This is a poster 0946, that looked across diseases in both rheumatoid arthritis and psoriatic arthritis. There were 2 cohorts, 400 plus patients with RA from the T-Rich cohort, 500 plus patients with PsA from the DPAR cohort. And what they looked into was whether or not people had anxiety, depressive symptoms, and so on. And so they looked at baseline, and then they looked at that would affect the outcome at 2 years. And so, first of all, big numbers. At baseline, 1 patient out of 5 had depressive symptoms. 1 patient out of 3 had anxiety disorder. I mean, obviously, we want to compare that with the general population, and it didn't do that, but it still looks like it's a lot. That was for RA, and then in PsA, it was roughly 20%, so 1 patient out of 5 for each depression and anxiety, which again is a lot. And so one thing that was really interesting as well is that those people that do display depressive symptoms and anxiety disorder were less likely to achieve remission in 2 years, whether they've got RA or PsA. And the odd ratio are pretty impressive, especially in PsA. The odd ratio to not achieve remission at 2 years when you've got depression is like 6. So it really does matter. I mean, obviously there's a lot of confounding factor there potentially, but also does it really matter whether or not people have confounding factors? Maybe this is just something we need to address and treat appropriately, which I don't think a lot of us do on a regular basis. Now, the other thing that I found really interesting, they look at 1 year, and those people that display depressive symptoms at baseline also had higher ESR at 1 year, and these are RA patients. And those PsA patients with depression at baseline had a higher number of swollen joint count as well as CRP, which as well is not only how do they feel, but they do display higher signs of inflammation as well. So once again, this could be related to confounding factors, and we need to not exclude that. But I think this is definitely something that we need to look into more. Follow me on Twitter for more content, Aurelie Romo, and follow Now, and don't miss our 6 p.m. panel for a recap of the day. See you around.